Welcome back dear friends, I am Dr. Klim Raza. Today in this video lecture we are going to discuss about the joints. Joint is simply the connection of the bones, and we have got more than 230 joints in our body. Majority of them are freely movable. As you can see, I can move my shoulder joint, I can move my elbow joint, I can move my wrist joint also. So actually these freely movable joints are called as synovial joints, and some joints are actually connected with the help of the fibrous connective tissue, and those are called as fibrous joints, and majority of the fibrous joints are actually not movable or the slightly movable. And some joints are actually connected with the help of the cartilage, and these are called as cartilaginous joints, and we will discuss about the classification of the joints today in detail. But first we have to understand that what are the basically types of the joints, and what is the actual definition of the joints, and how many joints are basically synovial joints, and what are the subtypes of the synovial joints. So actually joint, as I did mention, as you can see here, that introduction and function of the joints, that actually joint is a connection between two or more bones. So there are more than 230 joints in body, and actually the function of the joints is to connect bones, and bones are connected with the help of the ligaments. And we have to understand that there are a lot of ligaments in human body, and actually ligament is made up of flexible fibrous connective tissue. That's why we can easily move our joints in various directions. Next we can see that classification of the joints. In classification, here we can see the first classification. This is actually the synovial joints. As I did mention that synovial joints are actually rich in synovial fluid, and actual role of this synovial fluid is to lubricate the articulating surfaces of the bones, to reduce the friction, to reduce the inflammation. So whenever we are having pain, problem, inflammation in our joints, it means there is something wrong in the synovial fluid, or those fluid filled sacs which are called as bursas in case of the arthritis or in case of the bursitis. So we have to understand the clinical aspect of the joints also, especially those which are commonly involved in rheumatoid arthritis or the osteoarthritis as well. So synovial joints subtypes, later we will discuss in detail what are the plane joints, hinge joint, pivot joint, ellipsoid joint, saddle joint, and then ball and socket joints. Then we have got fibrous joints, and subtypes of the fibrous joints are sutures of the skull, and then we have got syndesmosis, and then we have got gomphoses. Then we have got cartilaginous joints. Actually we have got two types of the cartilaginous joints. We have got primary and we have got secondary cartilaginous joints. Next slide you can see here that fibrous joints. So suppose we are starting from the fibrous joints. Fibrous joints are bones are joined by with the help of fibrous tissue which is rich in collagen, which is the most abundant structural protein in human body. So actually the first type of the fibrous joint is the syndesmosis. Syndesmosis are basically those joints in which there is strong antrochous membrane, like in middle radioulnar joint or in your middle talofibular joint in the bones of the leg also. So these joints are called as syndesmosis joints. As you can see there, examples of these syndesmosis joints also. Then next we have got gomphoses joint. Gomphoses is the joint of the tooth and the socket with this strong periodontal ligament. So this is called as gomphoses, the joint of the tooth and sockets. This is also a subtype of the fibrous joints. Next we have got cartilaginous joints. Cartilaginous, the joints which are made up of cartilage, and most abundant cartilage as we know that in our body is the hyaline cartilage. So we have got two types of the cartilaginous joints. We have got primary cartilaginous joints and we have got secondary cartilaginous joints. Primary cartilaginous connected with the help of the hyaline cartilage, like manubrium and the first rib. Manubrium joint with the first rib, this is an example of the primary cartilaginous joints. So then we have got the joint of the epiphysis and diaphysis. This is like a joint of the growth plate. So that is rich in the hyaline cartilage. So you should understand this is also an example of primary cartilaginous joints. Okay, then you have got secondary cartilaginous joints. Actually these bones are connected by the fibrocartilage and hyaline cartilage, and these are the joints of the midline of human body, like you have got manubriosternal, or we have got this pubic symphysis joint, or posteriorly we have got joint of the intervertebral disc. So these are called as secondary cartilaginous joints. Okay, next here you can see the most abundant types of joints in human body, the most commonly involved in the dislocations, fractures, as these are commonly movable. So these are called as synovial joints. These are freely movable joints, having cavities filled by the synovial fluid, and they provide nutrition and lubricate the articular surfaces of the bones. So then next also have the bursas. Bursas is actually the fluid filled sac among the major joints like in shoulder joint and knee joint. Sometimes due to excessive kneeling or due to excessive inflammation, there will be inflammation, and sometimes these bursas get ruptured, and that is called as bursitis, very painful condition especially at the knee joint. So what are the subtypes of synovial joints? Number one, here you can see the plain joint. Actually the plain joint, the articular surfaces of two bones is very plain, and that's why this is referred as plain type of synovial joints. Like best example on the lateral side of the clavicle connection with the acromion process, this is an example of plain joint. Or we have got these intercarpal and then intertarsal bones also. This is also an example of plain joint. Next, very famous and common type of the synovial joint, hinge joint. As we know that the shape of these joint is like pulley shape, and their role is like flexion and extension. They are moving in usually one plane, and they have got strong collaterals like medial and lateral side to prevent the dislocation of the bones on the outer aspect or the inner aspect. So actually these are called as hinge joint. Major example of the hinge joint is the elbow joint, and then we have got knee joint also, and then ankle, and then interphalangeal joints also. These are also like example of the hinge joints. They also help in flexion and then extension. Next we have got pivot joint. So actually the pivot joint is typical those joints where round surface of the one bone is actually fixed in the concavity of the other bone. So best example is the head of the radius, which is wrapped in annular ligament and this radial notch of the ulna. So that is actually the proximal radioulnar joint. That's why when you are doing like supination and pronation, you are tilting, you are moving this head of the radius. So that is an example of basically the pivot joint. Our second example is the atlantoaxial joint. That is a dense process that is fixed in first cervical vertebra. So that is also giving a shape of the pivot joint. That is why that is called as pivot joint. Next we have got ellipsoid joint. This is another subtype of the synovial joint. So you can see that elliptical convex surface of the one bone is fixed in concavity or concave surface of the other bone. So best example is the radiocarpal bone, like the styloid process of the radius. Here you can see on the distal part of the this radioulnar joint. And the radiocarpal joint, especially the joint of the radius with the scaphoid, that is basically best example of ellipsoid joint, wrist joint. And then we have got metacarpophalangeal joint, MCP joint. And you should understand that MCP joint is clinically very important because this is one of commonly involved joint in case of the RA, rheumatoid arthritis. Then you have got metatarpophalangeal joint also. This is an example of ellipsoid joint. And then you have got atlanto-occipital joint also, atlanto-occipital. Then we have got saddle joint. As we know that saddle joint, the best example is this sternoclavicular joint. Sternoclavicular because that is giving a shape resemblance with the horse saddle. So that's why these are called as saddle tape joint. So articular surfaces are usually saddle shape. Then one of the major type of the synovial joint is the ball and socket joint. As according to their morphology, their shape, we know that one surface of the bone is basically ball shape, other is a socket like lenate cavity of the scapula or in the hip joint. So actually these are called as ball and socket joint, and these are basically freely movable joints. They help in movement in various direction in multi-axis. So we are having two major ball and socket joints like shoulder joint and hip joint. Then we have got two smaller also like incidostapetal bones of the middle ear like incis and stapes. Then we have got foot bones like talocalcaneo-navicular joint. These are also like example of the ball and socket joints. Then we can classify joints according to their articular surfaces also, like what are the simple joints. When you have got two articular surfaces, these are called as simple joints like shoulder joint, although this is ball and socket joint, major synovial joint, but because there are only two articular surfaces, so that's why this is called as simple synovial joint, or the hip joint also. Then compound joint, where we have got three or more articulation surfaces, so like radiocarpal joint, this is an example of compound joint. And we have got complex joints, where we have got 3 or more articulation surfaces, and best example is the knee joint. We know that in knee joint we have got a lot of structures, like there is articulation of patellar bone, kneecap, then there is tibia also, there are condyles of the femur also, then there are menisci. So there are a lot of structures, so that's why this knee joint is also called as complex joint. So we have to recall all the subtypes of the synovial joints, fibrous joints also, and we have to understand all the sutures also, like what are the different types of the sutures, where are the coronal sutures, squamous sutures, lumbdoid sutures, or what is the Schindel also, what is the Gaume also, and what are the subtypes of the synovial joints. I hope you understood. You have to watch this lecture. Please do generate your notes, and see you in next lecture. Thank you for your consideration.